You might know what Trousseau's sign is, but do you want to know why it happens? If so, keep listening. So, if you're unfamiliar with Trousseau's sign, this is what happens when we inflate the blood pressure cuff on our patients and they get those carpopedal spasms and they have like a dinosaur hand, and it's involuntary. The patient isn't doing this on their own. So, first of all, let me let that down because that kind of hurts. But Trousseau's sign happens when our patients are hypocalcemic. So, they have a low serum calcium level. First of all, let's back up and talk about what calcium actually does when it comes to muscle contraction. So, calcium works right here in the cardiac cycle. We know that potassium and sodium play a huge role in muscle contraction with the influx and outflux of those two ions, but calcium actually plays a part in the relaxation in between those cycles of that firing that tells the tissue to actually contract. So, if it plays the part in the relaxation after the repolarization of the cells, if we don't have enough of that relaxation ion, that tells us that it lowers the threshold to get that muscle to fire. And so, if we know that neuromuscular junction is already a lowered threshold because of the hypocalcemia, and now we come in and inflate a blood pressure cuff, that causes mild ischemia to the distal tissue. Look how quickly my arm gets purple. So, we have a mild ischemia, and this ischemia piled on top of that lowered threshold causes those muscles to go and contract. So next time you're running a blood pressure on your patient and you notice they get those carpopedal spasms, that's called Trousseau's sign, and you're going to need to look a little closer because your patient is likely hypocalcemic.